I believe that the problem was that there was a lot of confusion, a lot of misinformation. I believe that if this bill had passed, we would be able to do exactly what we're doing now. And according to the Arkansas Democrat Gazette in 2009, 4,580 women were able to have an abortion. This bill would not have changed that, but it would have said, because we don't know what the Patient Protection and Affordability Act will do. It's confusing, it's in transition. This bill would have protected those people that are against abortion from having their tax dollars used, and that was what it was about. And I'm disappointed, but we will be back. It was a hostile amendment, and he wanted to kill the bill, and that's where we are at this point.
My intent was to publicly ensure that when people spend their private dollars on their insurance policy, that we don't kill protection that they already have. That was my full intent. And as testified by the Insurance Commission, there are policies out there that offer exceptions for rape, incest, and the life of the mother. That's all it was.
And you think it's important to have those exceptions?
I think it is important to have those exceptions if they already had them in those policies. I don't think it's our place to tell people they spent their money and we're not going to cover them.
What about the debate that it was unconstitutional?
Well, if you, I have paperwork from the federal health bill, Affordable Health Care Plan Act, and on March the 24th, I believe it was, I don't want to get the date wrong, on March 24, 2010, the President issued an executive order establishing the language that Representative Bart Murdoch wanted in there that put those exact language in that bill. It doesn't put my stance on abortion at all. I'm out just protecting people's private dollars spent on their policy so that they be sure and get what they paid for. There's no reason in cutting coverage that they already have.
One of the reasons I came is because I focus on communicating public health policies, and I found that there was a lot of misconceptions around what was being said about this bill. It's been billed as predominantly a bill about public funding, when in fact it really doesn't have much to do with public funding for abortion at all. It has to do with regulating how private people spend their own private dollars on insurance premiums. And it was just a shame to see that issue get clouded in the debate.
So you think there's already enough protections that keep public funds from going to abortion?
I think there are plenty of protections. I think that there's literally not one dollar that could ever be spent, one public dollar that could be spent on abortion coverage in the state of Arkansas, both because of federal and existing state law, as well as the protections that are embedded in the Affordable Care Act with regard to exchanges. What this bill does do is it really unfairly discriminates against people who buy their insurance inside the exchange. So that means somebody who's self-employed or a small business owner who wanted to purchase inside the exchange would be limited in their coverage versus somebody who worked for a big company